Case of monkeypox has been detected in Sacramento. If confirmed, it will be the first case of the disease in the state. Health officials say the patient recently traveled to Europe, and right now the patient is said to be doing well and isolating at home.
CBS 8's Kelly Hessedall talked to a doctor and professor at UC San Diego. She joins us live in our newsroom with what the doctor had to say. Kelly?
That's right, Heather and Carlo. This professor told me monkeypox is something people should be aware of, but he says there's no need to panic. He says monkeypox is not contagious the way COVID is. But here is something he told me the research has shown.
A lot of the transmission networks, as we call them, have been in people who've been going to nightclubs, at events what they call raves, and so there's probably a lot of close contact or even sexual transmission.
And that is Dr. Douglas Richmond, a professor at UC San Diego. He says monkeypox is spread through close contact with people or animals infected with the virus, and that it can enter through the body through broken skin or the respiratory tract, so the eyes, nose, mouth. He says typically outbreaks of monkeypox have been animal to human. We saw an outbreak like this in the Midwest back in 2003. But what's odd about this outbreak is that it's spreading human to human. The CDC has said many of the patients are gay or bisexual men, that there have been several cases in Europe. Canada has had a handful of cases, and the U.S. so far has had around 7 or 8 suspected or confirmed cases. Now, symptoms begin with a respiratory infection, muscle aches, enlarged lymph nodes, and then a rash will appear. The bumps resemble smallpox and can scar your skin. The illness typically lasts anywhere from 2 to 4 weeks. I asked the doctor today, how concerned should people be?
Not going to be another huge pandemic, but it'll be an annoyance for a fair number of people, but it's not going to spread anywhere near like COVID.
And Dr. Richmond says the mortality rate is very low. If you've been vaccinated against smallpox, you likely have some protection against monkeypox. He says there is a vaccine specifically for it, and there are also drugs out there to treat this illness. Heather and Carlo.
Yeah, Kelly, are there any certain populations of people who should be more concerned than others with this?
Well, immunocompromised people should certainly be concerned, as well as people who have severe outbreaks of eczema, because it is transmissible through skin lesions. They may be at higher risk. But again, as the doctor said, for your average person, no, it's not going to be, fun to get it. You're going to have it for a couple of weeks, but it's certainly not, doesn't have the mortality rate that COVID does.
All right, spreading, but be concerned, but not overly concerned. Sounds like the message today. Kelly Hessedall reporting live for us. Thanks, Kelly.